Assalamu alaikum, the communication day. First scenario, you are the doctor, the medical registrar in the acute medical unit. John, 35 years old man, received a recent diagnosis that has been sent out from the hospital to the GP. John is concerned about this and wants to speak to you about this diagnosis and wants to keep it off record. Sit to Mr. John and address his concerns. Here it
Hello, I'm Dr. Ala. I'm the doctor in the medical admission unit today. Let me confirm you are Mr. John, 35 years old.
Yes, Dr. Ala. Yeah, I'm John.
Uh, how can I help you, Mr. John, today?
Well, Dr. Ala, last week I have been had some blood tests in the unit, which has been came back confirming a diagnosis of HIV. And then, to be honest, I just moved. I'm transitioning between place to another, so I'm now registering myself with um, another GP. But when I went there to put my application, I found that someone I know already. Um, he works there,
Mm,
so um, I didn't him. I didn't want him, to be honest, to know
mm.
about that diagnosis.
I can understand this, Mr. John, and I'm sorry for what you have been going through recently. I can understand that it can be stressful for you, that the test of that result and what you faced also recently. So I can understand from what you say that you have someone working there. You don't want him to be aware of the result of the test. Is that right?
Yes, but I believe that
Mm,
the already the my discharge letter from the AMU
mm,
has been already sent,
mm,
and um, I think that he will have access to my
mm,
information, so he would
mm.
eventually know.
Uh, Actually, Mr. John, the result of such tests are being confidential. Okay, so the result should be showed only by you. Okay, and you are sending this to your GP, and no one else should ever see such result.
M- m-
Okay,
But it is in
so
the system, Dr. Ala. It's in the
mm,
system already. So anyone from
mm,
the GB Access would retrieve my information because if my notes is there, if
mm,
my information is being record within the record,
mm,
um, I usually anyone within the surgery or who
mm,
works with the surgery will be having access to that information.
mm. I can understand this, Mr. John, but let me assure you again that these results are confidential and should be accessed only by your GP and not anyone else. I think that no one else will have the access to check such result because it will be very confidential, and your GP only will be has the right to access such information. Let me assure for you that uh, that information.
Hmm.
Is
But
that okay?
um, yes, but usually if my what I would like to
Mm,
um uh that this result will be kept away from the GB, not to be accessed by the GB surgery at all, because technically anyone who works with within the surgery will be able to access my information because he's a person who works there. He's not
mm,
like accessing it because he wants to sneak out on me, but as if I'm there visiting the GB for blood test, He would know what kind of blood test, etc. So, what I think it could be
mm,
much safer option for me is that to keep this information hidden or kept off record for my GP. I will disclose it to my GP himself myself,
mm.
and I think this is the it could be a good way.
Okay, Mr. June, it's actually a valid concern, and I appreciate that. We can discuss this also, that you can disclose this information to your GP directly. Okay, but also from my side, I can help you, but by making sure that if even if such information sent to your GP by a letter or through the system, we can like make sure that such information will not be accessed by anyone other than your GP. Is that okay?
I don't think so that would be technical or applicable to happen.
Mm,
Um, uh, as I myself, I've been worked once in GP surgery, so I know how things usually works there.
mm,
Um, uh, I can you hear me? But I think
yeah.
would it be okay if we can amend the information about this diagnosis?
Uh, I appreciate your concern, Mr. June. Uh, One of the important thing that we are doing when we discovering that you have such infection,
Mm.
that we involve them, we include the GP in the information with us, that to help you anytime that you have any type of infection. You know that HIV can affect your defense system, and it can expose you uh, to have infection even with very weak bugs. At that time, when your GP is aware that you have such infection, he can start for you treatment directly. He can direct you to the proper facility to help you at that time. That's why we prefer to include your GP at that information to try to help you anytime you needed help. Uh,
Mm-hmm.
what do you
Yeah,
think about that?
I really appreciate that, Dr. Ala. That
Mm,
but I think in my first visit with my new GP, I would disclose this to him. But what I would like that this diagnosis will not be displayed to my health
mm,
record, that it can be seen by the GP. I will
mm,
ask him myself to add this diagnosis to his list, but it shouldn't be accessible like
mm.
um, uh,
2 minutes left.
from anyone. Um,
Can I
do you think this is applicable?
can I ask you, do you have any other reason other than that you are afraid like from another person to access this information?
No, already my family know, my partner know,
Mhm,
um,
mhm,
but I don't want this particular person, to be honest, to
mhm,
know. He's an old friend from school, but
mhm.
we
Yes.
know each other briefly, but it's he's simply I don't want him to know.
Yes, I can understand this, Mr. John. And how are you doing with the diagnosis of such condition and the start of the treatment? Uh,
Um, I'm doing fine, to be honest. I'm already the medication that I started with from the infectious disease clinic is working fine.
mhm.
Um, yeah. I didn't experience any side effect or
Yeah,
anything. But what concerns me is the
yeah. I'm happy for this. And you are following also the recommendation to take the precautions, uh, especially for the safe, intimate relationships and like that.
yeah, yeah, yeah,
Yeah,
yeah.
yeah, I appreciate that, Mr. John. regarding that point, I will do my best to help you regarding that point, to make sure that if we can help you only to disclose by yourself this
Would it be
information.
applicable? Would it be applicable, Dr. Ala, if you can speak to the IT in your in the hospital and raise a ticket about the diagnosis? I'm sure that they will be able to do something.
I appreciate your concern, Mr. John. We'll try our best also to check for that. Make sure that the confidentiality regarding this point is our first aim. Okay, so whatever we can do regarding this issue, we will try our best to
Yes,
help
no,
you
time is
regarding
up.
this.
Time's up. Yep. Thank you.
Yes, okay, thank you.
Okay, you can comment now, Dr. Omar.
Thank you. Thank you. Well done, Dr. Ala. It's a very challenging scenario.
Yeah, actually, I'm trying to figure
it's
is this like
but the patient does have the right.
specific point
Yeah.
that you
The
tell us.
patient does have the right to keep his information off record from the GP. Usually, the party of concern would be the infectious disease team, which then can, because antiretroviral wouldn't be dispensed from his GP, it will be dispensed from or managed by the infectious disease or microbiology team. Information sent from the AMU unit at the time of diagnosis in his discharge letter. The discharge letter gets automatically put on the patient information in the system, so anyone can access the letter, especially if it's the GP employee, the one who runs the appointment. He sends email to the patient to remind them about the appointment, so he will have access to the information actually, and this is what he was concerned about. He doesn't want his friend to know, or the one that he knows. It's a quite common request to have that some patient would like to keep his information off the system, and this is why it is very important when you are here, even you might sometimes see that the patient is on medication, on his medication list when you are a new patient coming for admission. But the list of diagnoses, you are expecting to see some diagnosis regarding with this. It doesn't match the medication list. So you would take history from the patient, you would find that few certain diagnoses is not added, it's not on the GP list, because usually the patient would like to keep it away from the GP. Sometimes they would like to keep it for even away from the employer, which also they do have the right to do so. So you can't disclose, if you don't want to disclose the diagnosis you have to your employer, there are certain rules that will be broke if you are a doctor and diagnosed with HIV. If you are not surgeon or you don't do invasive procedure, nothing. But if you are one who does invasive procedure, then the infectious disease will notify the occupational health of the department. There are certain rules, exceptions, but the general rule, you as a patient does have the right to keep your diagnosis away even from your GP. But the overall, the clinical judgment is okay. The clinical communication was very fine. I can give borderline in the concern because not because you wasn't performing well, but you you didn't clear cut looked for solution. If you don't have an answer, you can simply justify. I would ask about how we can what we can do about the diagnosis that has been already sent. Did you get my point, Dr. Ala?
Yes, so the main point here that the patient has the right to
Yes.
refuse that information to be disclosed to the GP.
Yes, you convince the patient. We would like, which you've done very well. We would like to
Mm.
involve your GP because he would know um, uh, uh, like that you are at risk of infection. So, for example, he can start you earlier on antibiotic. He wouldn't be reluctant to start you on antibiotic straight away. If you developed any signs of um, uh, early signs of infection, he would start him on antibiotics. This is the persuading way, which you've done very
Mm.
well. But the surrogate what's his issue? He wants to keep this off record. So the difficulty here that the information has already sent. So there is a technical problem. So you would like to see what we can do and then get back to him. But you should admit that this is really
Is right.
difficult. But yeah, it is right. It is his right. And it's at the same time, it's really difficult to be established because the information has been already sent out.
Mhm.
You get my point. He would say, yes, I suggested that you can refer to the IT or the regarding the usually the information. There is some point of contact that you can even write to the patient GP that he's asked to keep this right technical information or give a call to the GP surgery to ask to speak to the GP himself because he will be working in the GP. We do have XYZ situation. The patient wants to keep it off record. He is happy for you to be informed. Um, uh, is there anything that we can do? You know what I mean?
Yeah.
So this is like a practical solution. You don't need to use all of them. You can just use one of them, um, which is if you phrase like, I would see what we can do and come back to you. This would be completing your own
Yeah,
performance.
yeah, this is best answer whenever you don't know what the process. But I want to ask you, Dr. Omar, shall he say what he had?
In what he had, like
What
what?
what the diagnosis? Because I didn't hear the diagnosis, or Dr. Ala
Yeah,
doesn't.
HIV. Yeah, he should
HIV.
ask. He
Yeah,
should
but he,
ask.
yeah, you didn't ask Dr. Ala, right?
But I did give it to
No,
him because I
he
recognize, to be honest, that the scenario will be challenging.
he
So
he
it's
told from the first when I asked him how can I help
Yeah,
you, he
that's
told
why
me
I wanted you to go through the same steps of introduction. Tell me what you are suffering from. Tell me what you know about your condition. So do it as a classical one scenario. Then
mm,
proceed with the steps after knowing what he has.
Mhm.
Because you are talking about something which is like vague. You don't know what he has, and you are just trying to hide what he has, and you don't know what he has. You got
no,
it?
he told me that he has
Yes.
No, no.
HIV. He has HIV from the start.
I told him, Dr. Bassem.
Okay.
Yeah.
And
But
HIV
I didn't choose to keep it like
vague.
to keep it vague until what you have because he had his very good opening. So usually if someone would started like in a very inappropriate opening, then the surrogate would react. Yeah, okay, you know. So he read the scenario and he had a good opening that would force me to cooperate. You know what I mean?
yeah, yeah, I got it. But I'm asking, what if he asked earlier? Can you tell me by your own language what you are suffering from, what happened with you exactly, and what's expectation about this meeting? He will open up by
Yeah.
anyway. But to have the good introduction to let the patient feel comfort, this is my
Uh, uh,
opinion.
you mean Dr. Bassem to dig down more and how he diagnosed,
Yeah, yeah,
how
yeah.
he was diagnosed,
Yes,
and
yeah,
what about his condition and the treatment and
yes,
like this, and
yeah.
uh,
Even you will save, not save the time. You will have some time of knowing what he has exactly and why he doesn't want anyone to know. Is it something because of the infection itself or because of the risk habit he do? You don't know why even he has this infection and why he want to hide. Because of HIV only, because of employer only. We don't know exactly, but anyway, you did it perfect. What I want to say, You did good. You didn't have that much defect in the marks. For me, I can give you the same as judgment. Some of the scenario nowadays in this way. You argue with the patient or the surrogate, and you don't know what he wants exactly. As in this scenario, why he want to hide, why he want to make it as off record because of someone here working. But I cannot also control this. This is out of my hand. I cannot make this result as hidden or no one can see it. I cannot control the records.
But you can take steps. Like I would go and see what we can do, and then the next step we would write to your GP or talk to your GP. But I can't guarantee that the outcome would be
Exactly.
100% that the
Mm.
diagnosis will be taken off. But we are acting on your best interest, and and if you would like to to withhold this information from your GP, your rule as a physician is to act on the patient wish. So those are the three, four concepts on the communication scenarios that they would like to: patient autonomy, patient best interest, patient wishes, keep the patient like patient-centered consultation. Those key.
Yeah, I agree. I agree to make it as autonomy and follow the autonomy rule. But what if his GP, didn't know it? How he can manage
He's
him?
not. The GP can the GP doesn't manage the HIV medication. His HIV
I
medication
know.
is not dispensed from that, but it's a good way to persuade the surrogate, tell him that there is the benefit if your GP kept included.
Exactly.
But
Yes.
the surrogate, but I told him in my argument that I am happy that my GP know I'm changing the GP surgery from one surgery to another because I'm changing my place where where I'm living,
Okay.
changing houses. So I will speak to my GP myself and let him know. So my GP knows it from me verbally. He
Yeah.
will keep it in a note or whatever. I will remind it because this is my issue. I want this information hidden from this GP surgery.
Yeah. Okay.
Uh, so I will keep him informed.
Perfect. But again, you can try to convince him that his GP must know. Because you are following with him, everything will happen to you will be directly related to him, or you will be directly visiting him, whatever you are having. This is my point. You got
Yes,
it?
but the other point, yeah, yes, which is a very fair point in the chronic issues like diabetes, high blood pressure, endocrinological issues, but some sensitive diagnosis, usually the patient would ask to keep it away from the GP because sometimes the GP knows the family, because sometimes the
Okay.
GP knows him since he's a child. You know what I mean? And he does
Yes,
have the
yes.
right. This is
Okay.
the second point that we should enforce. The patient does have the right, even though if we agree that the GP it's for good continuous closed loop of information between the secondary and the primary care, that the information should be there, but unfortunately the patient does have the right to keep the diagnosis away.
Yes, exactly. Okay, what about giving some instruction and advice regarding the HIV?
It's not an HIV station. It is about the concern. He because I told him that I'm taking medication well. I've already let my partner know. I've
Okay. So he's already compliant and he knows
yeah, yeah,
about the diagnosis and the instruction, how to be adherent to the medication,
yeah.
what are the private and the
Intimate relation and safe
exactly,
sex.
yes. Yeah, yeah. This is what I want to say. Is it important or if he knows all these things, but if he has time, I think he can do.
He can
Yeah,
touch base with that, which Dr. Alaa did already.
exactly. Yeah.
But
Yes.
what he
Okay.
did that he kept holding the concern, put the concern on hold to catch this, but otherwise everything went very well, and it's very uncomfortable station to be honest.
Yeah, really, yes. Yeah. It's a difficult one. Okay. Okay. Thank you, Dr. Amar. Any question, Dr. Ala?
Uh, Yes, Dr. Omar. So
Mm.
from the start that I should confirm that the patient has the right to not declare this information to his GP.
Yes.
Yeah, so I should confirm that from the
Yeah,
start.
from the start, and then tell him.
Yeah.
But what we usually? Oh, I'm sorry. Yeah, continue.
Then offering the methods of help that of course I will try to convince him that it's better to inform the GP like about his condition, that if he had any infection or something he can help him. But then I
Yes.
will offer the methods to try to
Yes.
like to keep the information away from the system.
Yes. The information has already been sent. So if it's already been sent, this will make it difficult
Mm,
to take it out, to take it away. But what I will do is I will try to find a way that how we can do this. I can speak to the IT. I can speak also to my consultant, because I've never been in such a situation. You can acknowledge I've never faced such a situation before, but I will act on that, and either I will give you a call back or to return back to you after our discussion. How does that sound?
Yeah, perfect. I want to
yeah.
yeah, to repeat this part. Whenever you don't know the process, please say it clearly. I didn't manage this before. I didn't have like such situation before. So please give me time to ask my senior, and we'll be back to you. Okay.
They can tweak the scenario by saying that the patient has received this diagnosis, and it's not been sent out. So he's just been diagnosed today, for example, before his discharge, that his bloods came back. What would be your approach, Dr. Ala? And he have the same concern.
So the blood not sent, the result not sent already to
Yeah. So yeah, he
the
just freshly have the
Mhm.
diagnosis today.
Yeah,
I
we made
think
it
this is
clear
the
now. Yeah,
yeah.
it's more easy now that we will try first to convince him that it's better to inform the GP about this information, that if he had any type of infection or something, he can treat him directly or directly him to the proper pathway to take the treatment. And
Mhm.
then if he insists not to inform, that he has the right, and we will not send the information.
And then the remaining time would be we will refer you to the infectious disease, importance of safe sex, notifying your
Mm,
partner, how many partners you had in the last 6 months. This would be like a normal HIV station, like you know
mm,
what I mean?
yeah.
Even donation blood, sharing
Uh,
needles, and sharing the tools, private tools.
yeah, I think in this scenario, Dr. Basim, we are expected to take some sort of history about the exposure. What do you think? Do you have any idea where you might?
What could be the risk habit he had that he was,
Yes.
yeah, transmitted this virus to him?
So we can ask
I
questions
yeah.
freely in
I
this.
think, yeah, by giving some advices like don't share this, don't do so, don't have unprotected sex, he might open up and tell you, yes, doctor, actually, this one came before from an unprotected sex. Maybe,
Mhm.
but not to take history, because what's the matter now if I know if he has a partner? I will just give advice, right? What happened already
Mhm.
happened. Now I'm talking about how to prevent the spread of the infection, right?
Yes.
But he already contracted the infection, so I cannot have any benefit from asking about the past, unless it's coming from the partner, and I want to screen the partner from with him.
Yeah. So the if it comes in as a first diagnosis and his main concern is not to let his GP know, he has the right. We just would to clarify, you have the right to that. Would it be okay to tell me why you don't want to? You don't want your GP to know. He will tell you um, the same reason that that has been given today. Okay. Why we think it's important that GP would know? is that for him also, if you had any cough, any early signs of infection, he would start you on antibiotics very quickly. This is one benefit. He will tell you, yeah, but I will, like for example, I will let him know myself verbally in the first visit, um, because if he kept resisting, then it's fine. If he's not convinced, this is not a problem because it's his right. And then to go through the rest of the steps in HIV new diagnosis, safety netting about blood transfusion, sharing needle, protected sex, notifying partner, and asking about partners in the last 6 months, I guess.
Yeah, perfect. You can screen other partner, yeah, if he had, yes. So this is the take-home message. It's his right, but we will try to convince because he's the primary caregiver whenever he had any problem in his health. I mean the GP. So
Mhm.
please let your GP know if he insists. So okay, we will try not to disclose this to your GP. If he choose someone else to disclose the result for him, it's okay. Okay.
Mhm.
Yes. Thank you, Dr.
Dr.
Amar.
Basim, if
Yes.
refuse to inform partner, what I will do in this situation
Partner
after I convince
notification
him that's
program.
very important.
Yeah. This is
Partner.
another scenario. So it will be another scenario. You have to encourage him to inform the partner. Not only that, even screening the partner.
Partner
Why?
notification program. There's something that you would anonymously inform
Mhm.
the partner.
Yeah, but you have to encourage Dr. Salma. You
Yeah.
have to encourage for informing the partner. Why? Because she lives you, she lives with you, she loves you. She
Yes,
have,
yes, yes.
yeah, she has also a risk to transmit the infection to the kids if she has or she carries this virus in her body. Use this weapon to convince him. So he will be agreed. If he said not, if he's not agreed, you can convince him by saying, we can arrange co-meeting with you and your partner, or anonymous method, as Dr. Omar mentioned. So we will inform your partner by anonymous message. So she will not know that you are the one. But anyway, she should know that she should be screened. Okay.
But no need to arrange a meeting with a consultant to convince him.
If he refused totally, yes, you can at the end. By the way, anything you are difficult to convince anyone about a concern, at the end you can say, okay, I can arrange a meeting with my consultant. He is in a good position or proper position to inform or to convince you to do so. So this is the way to convince anyone at the end of your meeting after finishing all your trials. You got it?
Yes, thank you.
Okay, most welcome. Okay, any other question? It's nice scenario, Dr. Omar. Thank you. Your scenario, Dr. Omar, you are the doctor in the general medicine clinic. Mr. Adam Smith, 26 years old man, has been given an appointment to see you as he wants to be tested for Huntington disease. He is requesting this test because his 53 years old father, who lives abroad with his mother, was recently diagnosed with Huntington disease. So you'll sit with the son of a patient having Huntington. Whenever you're ready, let me know.
Yes, Dr. Basim. Dr. Ala, are you ready?
Okay, here you go.
Hi, hello. My name is Omar. I'm one of the doctors here and at the German Medicine Clinic. Are you Mr. Adam?
Yes, doctor, I am.
Hi, Mr. Adam. How can I help you today?
Actually, doctor, my parents are living abroad. My father and my mother are living abroad. My
Mm-hmm.
father recently started to have forgetfulness. Then he had such abnormal movements in his hand.
Mm-hmm.
My mom take him to a brain doctor, and they give him a diagnosis of very strange condition. I think its name is Huntington disease.
Oh, okay.
Then he informed them that this condition it's running in families, and my mom called me and informed me that they informed also that we can be tested to check if we will develop such condition. So that's why I came to you for that.
Well, I'm really sorry for your for the father's diagnosis. Second thing, you've done the right thing to come and seek for the information, and also your mom's advice is shows that she's really caring for you. I'll do my best to try to address all of your concerns today. So, Mr. Adam, is there anything that you are concerned about today?
Yes, doctor. I
Mhm.
actually I didn't understand what this condition and if like there is a treatment of such condition. So I want to
Okay.
know what is it exactly, and if also I have the chance to have such condition.
Okay. So all of the three concerns you told me this or questions are very important
Mm,
question. First of all, let's start to explain what Huntington's is.
mm,
Uh, it is indeed a condition that can run within family, uh, uh, but there it starts to usually exhibits itself by some involuntary movement,
mm,
uncontrolled due to damage of certain parts of the brain,
mm,
um, and can affect the memory and the mood also. This is what Huntington symptoms is. It can run to the family, but also in some certain cases, it can happen sporadically. So, did you have any family history of such a condition other than your father?
No, only my father, doctor.
Hmm. Okay. And on the your second your second concern, can you remind me about it?
Yes, doctor. Like, we also have the chance to have such condition.
Okay. There is such a chance. And usually it tends to can sometimes appear earlier in the next generation. Um, so your father was diagnosed, as from the record in front of me or the note, is at 53 years old. Is that right?
Yes, doctor.
And you are 26.
Yeah.
Okay. Usually, um, uh, if it runs in family, it can appear a little bit earlier in the next generation, which
Mm,
is also important to um, screen for that early.
mm.
So, do you
So
have any question? Oh, I'm sorry. Yeah, you
So,
want to
so
ask?
what's my chance, doctor, of getting such condition?
I think the best way to, in order to address this accurately, is to that we can refer you to genetic counseling first. We can arrange the genetic testing. Roughly,
Mm,
rough chances that if your father did have the affected gene only, there is around 50% chance that, as far as I remember, it could be 50% chance, but I would like to make sure about the exact chances,
Mhm.
percentage. On the other hand, the genetic counseling would be able also to answer this in a detailed way.
Okay, doctor.
Is
And
that? Mhm.
such condition, doctor, is it like serious condition? Is there a treatment for this condition?
Unfortunately, this condition is progressive.
Mm.
Progressive, by progressive, I mean it tend to get worse. It it's not going to be. It's difficult to be controlled by medications,
Mm.
and it is not curable.
Oh, are very bad news, doctor. So if I develop such condition, like will be like deteriorating, and maybe I will be like bit bound.
With with help of medications and um, input from other multiple teams, usually we can help getting control of the symptoms
Mm.
and improving the quality of life a little bit. But there is some point that till now there is no ultimate cure has been discovered for this disease,
Mm.
unfortunately. So the symptoms will get worse. I'm sorry to be telling you this
Yes.
frankly, but this is this but this saying this right now, this doesn't mean that you will for 100% have it. We
Mm.
need to arrange some um, genetic tests. Is that okay with you if I referred you to the genetic counseling and
Yes, doctor.
neurology
Yeah.
colleagues?
Yeah, I prefer to do this because it will be a great relief for me if I discover that I don't have such problem. So I have also my kid, doctor. He's 7 year
Mhm.
old. So if I have this problem, he will have the chance also of getting such problem.
Um, there is a chance that he will have it, and there is a chance that he doesn't have it. So I think also for the genetic counseling and testing, your father presence is important. Do you think that your father is able to attend the genetic counseling?
2 minutes left.
No, no, doctor. He's living abroad. He's not living
Hmm.
here.
Hmm.
Mm. So can I bring my kid, doctor, also to do the test?
Um, I guess there is no problem, but uh, in doing the test, I would follow the advice of the genetic counseling. To be honest, the genetic testing and genetic counseling team.
Okay, doctor, because also I need to make sure that also he doesn't have
Yes.
such a problem, and uh, not also carry this burden on me. I am also, doctor, trying to have a baby. Okay, and
Hmm.
at the previous period we were trying to have a baby. Is there any chance that we can prevent it from happening to our future children?
Um, actually, if is your wife is pregnant right now or your
Uh,
partner?
ac- Actually, we don't know yet, but we are
Hmm.
trying over the previous period.
I'm I'm uh I'm not aware of such um, uh, method of genetic treatment, but if there
Mm.
is, it would be advised by the genetic counseling
Mhm.
and the genetic testing team.
Okay. Dr. Basil,
Did
if you allow one more concern.
Okay, last concern. Continue.
Okay. So, doctor, you told that this condition, there is no treatment for such condition.
No cure. Yeah.
Yeah, no cure for such condition. So, what's your opinion if I did the test and I discovered that I have such a gene or a problem? What will be the benefit and what will be the risks of doing such test?
Well, it depends on your wish. Are you willing to chase the diagnosis? Do you really want to know if you have the gene or not?
Mhm. Okay.
Do you if you don't want to, then there would be no point of doing it at the
Mhm.
time being. We will keep monitoring the symptoms if there is any symptoms happens, such as involuntary movement, mood changes, depression,
Mhm.
any thoughts of harming yourself.
Okay.
Okay, doctor.
Thank you, Dr. Omar.
Thank
Well
you.
done. Dr. Ala, you can comment.
Thank you, Dr. Omar. Actually, well done. Only few comments. Actually, you know the mode of inheritance for
Autosomal
Huntington.
dominant. Autosomal
Yeah.
dominant.
Yeah, because I thought you were hesitant to inform the chance of.
I was thinking about, I didn't remember exactly the chance. Was it 50% or 25? Because I didn't read it for like maybe 3 or 4 months now. So
Yeah, but autosomal dominant 50%.
yeah.
And you already explained the anticipation and that the condition that can come early in the next generation and can also come more severe.
Mm-hmm.
The thing that in this condition, you should by yourself that you already explained the disease and the disease that there is no cure for such disease. You should figure out why he want to do the test.
Okay.
Okay, why he want to be tested for such condition. Okay, why he want to do the test.
Mm-hmm.
Okay, then you explain to him the pros and cons for doing the test.
Okay.
Okay, because the all what we are technical, the all technical information will be explained to him as you have mentioned by the genetic counseling team.
Mm.
How the test will be done, the access and everything will be explained by the genetic counseling team. But your job is to explain the disease, to counsel about the disease, how the disease is behaving, there's the course of the disease, the complications, the treatments available. As you have mentioned, there is no cure, only we will treat the symptoms like this. Then you explore why he want to do the test.
Mm-hmm.
Okay. To know what's his intent, what he's actually thinking about. Then you explain to him the pros and cons of doing the test.
Mm-hmm.
Okay. In such condition that there is no treatment or there is no absolute cure for such condition. Yeah. The only pros for doing the test that they are telling that some people want just to know that to live the remaining time of their life as much as they can to try to make their targets. Okay, as there is no treatment, there is no pre-treatment. We will not help him. We'll just confirm that he has the diagnosis, and then he know that at any time he will develop the disease. So if he has like specific targets in his life, if he has like something he wanna accomplish in his life, he can do it. The benefits, other benefit also that he can relieve himself from the stress that thinking continuously that he will have the disease or he will not have the disease. He will have the disease or not have the disease. So if he do the test that he knows, so he will relieve that "Yes, I will have the disease, or he doesn't. He know also that he will not have the disease. So he will relieve himself from the stress. These only the two benefits that expected from doing such test.
Mm-hmm.
Okay. The cons or the bad thing that if he did the test and the test came out to be positive, there is the stress also that he knows that he will have such condition that he may affect on him in like different ways, like psychologically or socially or something like this. And also the insurance.
Mm-hmm. So should
Yeah.
we discourage him from having the test, you think?
Not discourage. This is his choice. You will explain the pros and cons.
Mm-hmm.
You should explain the pros and cons. Then this is his choice at the end to do the test
Mm-hmm.
or to not do the test.
Mm-hmm.
Okay. The cons, as I have mentioned you, that the stress that or the consequences that he may have after knowing that he will have such devastating disease, and also the insurance. Okay. His insurance may be affected. The coverage may be
Yeah.
affected. Yeah, the requirements will be it differs from place to place.
Mm-hmm.
Okay, these are the thing that only was defective in the communication that you didn't. That's why he asked you in the end that what's the benefit if I did the test or I didn't do, as there is no cure.
Mm-hmm.
Such diseases that there is no cure, so it should explain the pros and cons of doing such test. Regarding the concern of his kid, okay, that he is a 7-year old kid. Actually, if there is no treatment or there is no help can be offered,
Mm-hmm.
no one has the right to do a genetic test for him for the kid. Okay, until he is 18 years old, then he will decide for himself. Okay, so
For
we
the
will
kid.
inform. Yeah, because there
No,
is
no,
no
can you
cure.
explain this again? Yeah, yeah.
There is no benefit. There is no
Mm.
cure. Okay,
No,
there
no,
is
no. The last bit about the child.
yeah.
No one can not.
No one cannot do the genetic test for the kid until he reach the 18 years old, and the kid then he will decide for himself.
16 دكتور علاء in UK.
16, okay, because I read it 18 also. Okay,
But
so
the genetic in Gosh hospitals, which is the one of the pediatric genetic diseases, usually what they are doing
They are doing after consent.
from yes. So if the father uh, uh, is wishing that to do a genetic testing for a potential disease that runs in family, so we should say to him, no, we will not, because I didn't know this, to be honest.
What's the
unless there is
exactly
A cure.
if there is cure can be offered from the start.
Mm-hmm.
But if nothing will be offered, what the benefit of doing the test now without giving any medication, giving or doing something can help the child. So let him wait till the age of 16, and he can decide whenever he's adult to do it or no. You got
Mm-hmm.
it? Yeah.
Okay,
yes,
yeah.
exactly, and I think the two scenarios that you will face is medullary thyroid carcinoma. Okay, this mean two cases that they can do prophylactic thyroidectomy, so they can test the kid for it to do the prophylactic thyroidectomy.
Mm-hmm.
And also the who come if he started to have symptoms like shortness of breath or chest pain, they can also start doing tests for her.
And the adult polycystic kidney disease.
Yeah.
But for usually in the ADPKD, they start
Yeah.
diagnosing by the
Ultrasound.
screening by
yeah.
ultrasound. But if there is if it's vague or anything, or the renal team is concerned, they usually recommend for that. But yeah, thank you, Dr. Ala, for bringing this scenario, because I guess I've done it or read it in my first attempt, and I remember what you are just saying. I was remembering it, trying to remember it vaguely when I was doing the scenario, but I wasn't sure. Yeah, you are right. Yeah, but this is the first time I know that about the genetic testing for Huntington in 7 year in children.
Yeah. If there is no treatment or there is no cure can be offered
Exactly.
to the kid, this should be left until he's adult and he decide for himself.
Mm-hmm. Okay.
Okay.
Even
The
the
very
adult polycystic kidney disease, sorry to interrupt you, you will wait till the age of 20 because the presentation and the cyst appeared after the 20.
Yes, yeah.
but also the good thing about the test, we should ask him, is there a specific reason why you would like to go for the test? He would say for relief. So you should
Yes.
acknowledge, yes, but also there is a 50/50 chance that you might have the gene, you might
Then you
not
should
having it.
explain the pros and the
Then,
cons of doing the test.
but if it's found, then it will go to your medical record. Then your insurance will, health insurance will increase if you are applying for or traveling.
Mm,
Traveling insurance would be expensive.
exactly.
What else?
Life insurance also.
Life insurance.
Yeah. But you can mention it like it will affect your insurance in general.
Your insurance, yeah.
Mm. The last concern regarding preventing this from happening to my future children. Okay, as you have mentioned,
Mhm.
you can refer it like to the genetic counseling, like they can help, or also you can involve the like fertility, the fertility team. Okay, like there is no now new methods, new advanced methods, like they can select the sperm,
Healthy sperm.
or yeah, they can select the sperm, or they can do what we are calling in vitro fertilization. Then they select the embryo that
But they will do
devoid.
they will need a genetic test to be
Yeah,
probed. So if I offer this and at the same time I'm not, um uh he should be having a genetic test first
first,
for
yeah,
the list.
yeah. Every question he asks you, you should tell him also, yeah, like this. We should firstly we need to make sure that you have the, or you should ask him that if you have the positive test, your child will have the 50%, like that, because he is asking
No,
about the child.
no,
If you
no.
have,
My question is about the how to prevent it in the as he's trying
Yeah.
to have
have,
another kid.
Yeah. So,
Uh,
yes.
and there is like a techniques that would help choosing the healthy sperms.
mm,
But as far as I understand, you need to have like, I don't know, can it be done without having a genetic test? This is my question.
No, no,
no,
yes. You're right, Doctor. Let me answer this, Dr. Ala. So this
yes,
is
yes,
the only indication to do genetic testing if he is planning to have kids.
Okay.
Yeah, so definitely without the genetic testing, you cannot do the sperm selection because you don't know how you can do it without knowing if he has the gene. If he had the gene, you can go with the genetic selection or the sperm selection. If he doesn't have the gene, so he's safe and the kids will be safe. Okay, so you have to do it before doing the sperm selection to do the genetic testing, and this is the only indication to encourage for. So all the scenario went good regarding the screening. No need to screen the kid, okay, even himself. What the benefit of screening the patient himself? He will just have stress, he will lose his insurance, he will be in trouble. Since he's having no symptoms, no need to do the screening, okay. You have to appreciate his father also condition and to be sorry for that. But no benefit to know the test right now unless he's planning to have another kid and he wants them to be clear if he has the gene. Otherwise, no need to screen. This is the first point. Screening the kid, as Dr. Ala said, no need right now, no benefit because I already discourage you not to have the test. So the same for the same idea for the baby. What I have to offer if he's positive, nothing. And plus, no autonomy, he cannot choose now. Unless there is something to be offered, I can encourage, like as Dr. Ala said, men type 1, you can offer it, sorry, men type 2, to do the prophylactic thyroidectomy. Otherwise, no need to encourage. HOCM
Mm-hmm.
also can be encouraged. Adult polycystic kidney disease, not to encourage because it's something to be done after 20 for the
Mm-hmm.
kids, I mean. So they can choose, or after 20, if he want to do, the screening will be by ultrasound. If they're encouraged, yes, you can encourage in two conditions. The same if he has planned to have baby, or if he has direct contact sport, he is planning to join military, so he can do it as a genetic or as ultrasound. If the ultrasound not showing cyst, then he can go for the genetic testing. Okay, this is
Mm-hmm.
as a summary. What the criteria of doing genetic selection, genetic testing, the indication to encourage, discourage. Our scenario today at all, no this, no encourage. Instead, you will discourage. However, he has the choice, as Dr. Ala said. You will not push him, but you can tell him what the benefit if you have the test now as positive. You will just have the stress, so he will be thinking before doing the test, plus the insurance, as Dr. Ala said. This in summary. What about the genetic scenarios
Mm-hmm.
in cases? The whole camp?
So
What is
for this
yeah,
for this scenario, if I should ask him what can I know why is there any specific particular
exactly.
reason that it's important for you to uh,
Yes,
from your point of view to have the test? If he said because I'm starting a family or I'm trying to have
yes.
a kid, then
Good.
we should go pro, like go with the genetic
Yeah,
testing.
exactly. You will refer him to the genetic counselor team. They will sit with him and they will proceed, or they will have this process with him. This is the only indication. If he has only just, I want to know because I'm worried if I have the gene. So, what the benefit if you know now the diagnosis, you have the gene or no? Nothing will be
So,
offered to you. Whenever you have the
mhm.
symptoms, visit us and we can treat you and confirm the diagnosis.
And regarding the if he told that he is concerned about is he starting a family, and then usually I should anticipate the next concern would be what we can do to decrease the chances. So we would refer him to the
Yes.
what team? What type of
Genetic
team?
counseling. Genetic
So
counseling
is it the
and
genetic counseling or the OBG, Ops and Gynae or
no, 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 genetic first. You said it. You have to screen first. If he
yes.
has the gene, then he can process with
Hmm.
the genetic or sperm selection. But if he
Okay.
doesn't have the gene, what the benefit? So he will be free. He can do whatever he wants. He doesn't have the gene.
Would this scenario comes with freezing the sperms concern? Like,
No, 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 no.
no.
Freezing the sperms with the chemotherapy.
Okay.
Okay. Yes.
Okay.
Don't forget to always confirm the patient data by two ways: the patient
Hmm.
name and the patient age, because you just said you are Mr. Adam and you proceed on. You have to confirm two data: patient name, first and second, even third name. You are Mr. Adam Smith, Robert, whatever the name, and your age is 35, 55, whatever the age. Don't depend only on the name. You are Mr. Smith, yes, and proceed. Okay, it's wrong. That's why I minus you in the clinical communication. I agreed about this. And the clinical judgment also regarding the decision to encourage for the baby screening, which is wrong decision. You cannot do this.
Okay.
The concern, the welfare, okay, maintained. But what about driving and the job, the smoking, the alcohol? Also in the communication, they might minus you. Don't forget those things. Okay? Smoking, alcohol, in general, it can affect him. In particular, the alcohol, because the alcohol always toxic to the brain. So you have to ask these questions whenever you have. And the job itself, what's your job? How you are coping with your job? Do you need any support? Okay.
He doesn't have symptoms right now, so and we are not sure. So
Yes, I mean just to offer if you have time, but put it in your mind always as a approach. Yeah.
yes.
Okay. Any question, Dr. Omar or Dr. Ala?
Thank you, Dr. Bassem.
Okay. Dr. Salma wrote a medication, tetrabenazine. Medication can be given, but it will not. I think this is for the abnormal movement, but it will not cure or stop the progression of the disease. By the way, the definition and the explanation, the disease and manifestation was perfect, Dr. Omar. Damage of the area of the brain that happened due to the gene or running in the family. And the manifestation, as you said, abnormal movement, involuntary ones, that it can involve all your body. And the movement are purposeless. And it can affect the mood. Even it might lead to the depression. You can add also. And the behavior changes. So unfortunately, it's progressive one. Anticipation is there. So the next generation will be expected to have the disease or the manifestation earlier than the previous generation. Okay. So it's good about explanation, but again, the point is the concern of encourage or discourage what the benefits and the risk, cons and pros. You have to know what are them and to discuss it with him. At the end, he will decide. But your way to convince will show the examiner that you are knowing what disease to be encouraged, and what other not to be encouraged or to be discouraged.
So if we are giving the pros and cons uh, about the genetic testing, would it be wise to to leave the pressure, acknowledging that I was thinking, okay, so I know that this is too much to take on such a single visit. We can arrange another visit. You can have a th thought about it, discuss this with your partner, and then we can have a further meeting. Um, I guess this would be also a wise thing to add or to in such situation if the scenario is not is as it came today.
Yeah, always talk in this way, cons and pros. This is the way how to talk about the genetic screening on counseling. Yeah, even the procedure. You are usually saying the side effect and the benefit, which also the same. And you have to be honest while talking about these things, the procedure, the screening, the testing. All these things will be explained in this way, cons and pros. Okay. And also the summary of Dr. Ala advice was in the same way. What the cons and what the pros of doing this test today? Is it important to do? What if you do and it came positive? What if you do and it came negative? Okay. In Huntington, in particularly, no benefit. Nothing will be offered, no medication, no cure. So the only thing the patient will have is the stress, unless the only indication to encourage or to do the test whenever he's planning to have a kid and he want to do the sperm selection, or you will tell him that we can solve this by doing the sperm selection and in this way you can prevent the transmission of the gene to the son if you have it. Okay.
Mm-hmm.
Okay. The second or the last information that you mentioned 50%. Be sure that you are saying 50%. It's a clear autosomal dominant condition, so it's 50% running in family, and there is anticipation. You have to explain it, which you already done.
Mm-hmm.
Okay. Any other question?
Nope.
Okay, Dr. Ala.
Thank you, Dr. Bashar.
Okay, thank you. Any other question from others? Clear for all? We will add this session to the previous Huntington screening, our Huntington sessions, because we have done a lot of Huntington and the same concept, same principle. We didn't change our mind. Usually we are doing this, and this is the rules and the preferred method to do with the Huntington screening. Okay, so again, no need to encourage, plus try to give him the pros and cons and tell him if we have done this test, what you will have and you will not, what you will not have. In this way, he would be convinced and he will choose the proper, unless again he has planned to have a baby, so he can do it just to be safe or to have safe baby from this disease. Okay, thank you, Dr. Amar, Dr. Ala. Thank you.
Thank you.
Thank you,
Yes.
Dr. Bassem. Thank you, Dr. Ala.
Thank you,
Okay.
Dr. Omar. Thank you.
Now we can wish you a happy and nice weekend. See you, inshallah, in the next week. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam.